Hi, everybody. Welcome to another episode of Be Well with Dr. Stockwell. We're very honored today. We have the Dr. Erica Stockwell with us here, and she is going to be talking to us about her background and why she is the epitome of the expert on prenatal vitamins. She's pretty awesome. She's young, qualified, high speed. That's my term. That's not a business term or a medical term, but she's very high speed. She's very knowledgeable, and she is going to give us a background on why she decided to start her own company and why this particular prenatal vitamin. So without further ado, for our very first opening episode of Be Well with Dr. Stockwell, here is Dr. Erica Stockwell.
Yeah, well, thank you for that amazing introduction.
No problem. It's easy.
Yeah, so hi, everybody. I'm Dr. Stockwell. I am an OB-GYN here in Las Vegas, Nevada. And I guess, I'll start from, I grew up in Wisconsin outside of Milwaukee. My mother was a nurse. My father was an engineer. And my mother got us interested in medicine at a very early age. We volunteered at several different hospitals. We lived right across the street from a nursing home. So I grew up volunteering at the nursing home and at the hospitals. I remember walking up and down the children's cancer ward and bringing my little palette of face paints and offering face paints to the kids. And so just really, really saw how important it was to be able to help people out in their time of need, and really was the draw for me to medicine. So from as early as I can remember, I always wanted to enter into medicine. I have two sisters as well who have also gone into medicine themselves, probably also from my mother's influence on us at a young age. So I also really loved math and science, also probably from my father's influence as an engineer. And I thought the best combination of medicine and the science would be to enter into the field of surgery. So in high school, I really put my eyes set on becoming a surgeon. I wanted to also, come from a background of something that I could go into if for some reason medicine didn't pan out. So I went to college for biomedical engineering, and I became a biomedical engineer, and I loved it. I loved problem solving. I loved working on design teams and coming up with solutions to different problems to help people out. And I worked for a couple of years at the University of Minnesota working on synthesizing different biomaterials such as microspheres for drug delivery system. I worked on a couple other medical devices, a patient positioning system. I helped work on...
What's a microsphere? I got a layperson. Yeah. I'm just the CEO. I'm just the business end of Stockwell Medical. I am not the brains. That would be Erica. So what is a microsphere?
A microsphere is basically a very small device, a drug delivery device. So I synthesize different microspheres with different agents in them. So for example, at the time of surgery, I encapsulated an anti-adhesion or adhesion barrier in these little microspheres. So we would put them over in different areas that we've operated on. Through my research, we did this on animal models, and this would prevent adhesions. So for us, when we operate, we want to definitely make sure that we're doing things to prevent scar tissue formation, because if a patient ever has to go back to surgery, it makes the surgery much more complicated if they have scar tissue attaching their organs, but also can cause issues for the patient, such as bowel obstruction and chronic pain. And so these type of things are important to think about when we go in and operate. So that's what a microsphere is. I also worked with a couple neurosurgeons who were doing research on glioblastoma multiforme, which is a very aggressive and lethal form of brain cancer. And we were looking at using the microspheres as a drug delivery system for fighting the tumor. And
wow.
so that was really interesting. I also got to work on prostheses, such as hip implants. I was able to work on a penile implant, so for erection. So that was really interesting.
Wow. Not only OB, but
right.
urology
kind of stuff
everything
thrown in there. So anyway, so from there, I entered medical school, and I thought in my head that I wanted to do something like orthosurgery and be able to still be very heavily integrated in the device world. And I liked surgery a lot. I rotated through a couple different surgical fields, and I didn't really find that one, though, that one that really leapt out to me. I participated in a couple different medical mission trips throughout my undergrad and also in medical school. And one really changed kind of the path of where I decided that I wanted to go. I went to Tanzania for a summer, and I got to live with and work with a Maasai tribe out there. And the Maasai are polygamous people. And I was amazed at these women who came together and formed really kind of their own tribe, per se, of women who really did everything. They raised the kids, they cooked, they tended to the animals, and really ran kind of these little villages within the larger Maasai arena. And I was lucky enough, I was able to help out a lot of these Maasai women medically. And I was able to educate these women on female issues and educate them on hygiene. I was able to participate in a birth, and I also dealt with a patient who had a life-threatening hemorrhage. And this kind of, I felt like the most satisfaction of helping these women out. So when I came back to the States and continued my rotations, one of my last rotations actually of my third year medical school was OB-GYN. It was something I hadn't even thought of before. And I loved it. It was the first one that really leapt out to me as far as feeling that satisfaction that I was, really doing big things to help women out. And I also found that, women are so underserved in medicine. I mean, there's so much focus on different areas of medicine, especially in surgery, so much focus on all these other surgical specialties, but for women's health, it really is kind of all lumped together just in OB-GYN. And so I felt that is where I could really implement the most change and really make a big difference. And I didn't think I was going to love delivering babies, but I love delivering babies. It's so much fun. It's the most satisfying thing to be able to deliver, a nice, healthy, happy baby and change the course of family's life or mom's life forever. And so definitely within a week of doing that rotation, I said, this is my call and this is what I want to be. I want to be an OB-GYN. And I also got to do a lot of surgery. So a lot of people don't think, they'll think of OB-GYNs as being surgeons, but they certainly are. We do a lot of surgery outside of just cesarean sections. We do hysterectomies, we do surgery for fertility, fibroid surgery, endometriosis surgery, precancerous lesions, so many different things that we do. And I wanted to delve into and explore that surgery realm of women's health a little bit more. So my medical school was in Chicago. I went back to the University of Minnesota for residency in OB-GYN. And partway through my residency, I decided I wanted to further my surgical skills, and I wanted to do a fellowship training, which is an optional training after residency, in order to further specialize. And so I did a fellowship in minimally invasive surgery, which is what brought me here to Vegas. Las Vegas Minimally Invasive Surgery. We're one of 43 programs in the country through AAGL, which is American Academy of Gynecologic Laparoscopists, and really one of the highest volume programs in the country. So I came here to Vegas, and I also had this crazy idea that I really wanted to get some business training. So all through medical school and through engineering, really, I didn't get much business at all. I mean, really, doctors, I will be the first to admit it, we're horrible business people because we don't get any type of training in it. And, we don't like to think of medicine as a business, but truly it is. It is a business. Yeah. And so when I interviewed out here in Las Vegas and everywhere that I interviewed, I told them that I wanted to get my MBA, and I was willing to do it on the side and willing to do it at night and online if needed be. And most people thought it was crazy. They wanted me to focus on the fellowship, but
you didn't have anything else going on with
right,
life,
you know, it's
family,
not that I was,
fellowship,
wasn't
job.
pregnant, which I was at the time. And yeah, so Dr. Volker, who's the program director here for the Las Vegas Minimally Invasive Surgical Fellowship Program, was completely on board. He's a big business guy himself, and he thought that was a great idea. And he actually helped to line it up for me and integrate it as part of my fellowship training. So that is where I got to meet you and all these awesome people here in Las Vegas through the Executive MBA program through the University of Nevada, Las Vegas. And that was an 18-month program. I did it alongside my fellowship training. I delivered my second baby right before that started, and it's been great. I will say the business training on top of the medicine and on top of the engineering has really been the icing on top, or the cherry, I guess, on top of the sundae that has just, put it all together. For, cliche's sake, making my Sunday complete. And it's been great. And it has really motivated me to create this company and motivated me to bring my, one of my product ideas to life. So the product idea actually it started from when I was a resident and I was pregnant. My first year of residency, my husband and I, we became pregnant with our first daughter, Miley, and it was really hard to be pregnant and a resident and working just those crazy hours.
Because you guys don't have hours, really. You're just on.
Well, they call it a resident on purpose because you live in the hospital. So It was hard because I definitely experienced morning sickness and being up all night and then working during the day. It was really hard to try to continue to work at full steam and help other patients out when I myself was feeling very ill. And there are definitely episodes that I would have to excuse myself and run to the restroom and vomit. So I thought, well, here I am trying to take these prenatal vitamins, and I'm so sick I can't take them, and I'm not taking them. But I'm being a hypocrite because I'm telling my patients, you really should be taking your prenatal vitamins. And I just thought, this is crazy. There's got to be something better out there. And what I found at the time I switched from the big horse pills, which really made me sick in my stomach, and I switched to doing the gummies, and even that made me so sick. They're just coated in sugar, and I found out by looking at the ingredients that a lot of the gummies don't actually contain all of the ingredients that I would recommend in a vitamin. Like a lot of them don't have iron. A lot of them don't have DHA, because the DHA will make them more fishy tasting. And if they did have DHA, they didn't taste good, even though they were coated in sugar.
You take multiple gummies.
Yes.
It's not just one.
It's not just
like
one.
6.
Yeah. Depending on the brand, anywhere from 2 to 6. And it wasn't really the best alternative. So, I was thinking, gosh, what about a powder? Wouldn't that be great if there was a powdered vitamin that you could just put into your drink, just like an emergency, or the Crystal Light, the Crystal Light packages. So what if there was a powder that you could just drink? Because that's the other issue with being so nauseous, is a lot of women aren't hydrating properly. So if you're feeling sick, you're not going to want to be drinking a whole lot of water. So wouldn't it be great if there was something like that would help women to get all their nutritional requirements out of a prenatal vitamin, but also to help with nausea, help prevent nausea, and then also to help with hydration. And so it was just kind of an idea in the back of my head that I never, at that point, seriously considered taking to market or creating a business. And then it went through residency, saw many patients with morning sickness, some so terrible that they had to be hospitalized and on IV fluids, and some had to get Zofran pumps and constantly pump them, full of anti-nausea medication.
And Zofran is tough on, is it your liver or your kidneys or both?
Yeah, Zofran can be tough, and it could cause major constipation, which actually leads to worsening nausea, and now we actually don't recommend Zofran in the first trimester because of a associated risk with cleft palate, which in the first trimester is when most people, really need some anti-nausea. So anyway, going through residency, kind of just always had this idea on the back of my mind, and then moved here to Las Vegas to pursue the fellowship. I was pregnant with my second child at that time, Jordan, my son. Again, experienced morning sickness. Luckily, it wasn't as bad as the first time around, but yeah, and then this idea, came to light again. And actually, during our MBA program, we had that assignment where we had to create a business plan for either an existing or fictional business. And I brought this idea to our team, and you guys all thought it was a great idea. And then that's when I really started to look into it. I created a formulation. I went to a local supplier manufacturing company here in Las Vegas, and they helped to create it with me. We went through 9 different revisions and finally came up with a rendition that I was very happy with. And we wrote the business plan and looked at what it would take to actually take this to market and make it a company. And we did. And you guys helped me out and helped make this dream a reality. And I'm so excited and appreciative. And I'm just so excited to see where we'll go from here.
Awesome. Yeah, we use everything about our prenatal vitamin here is locally, not necessarily locally sourced. Unfortunately, we couldn't get all the components here in Las Vegas. Kind of hard to find algal oil and things of that nature here.
Right.
However, we do package everything here, and we do use a local company called ANC, American Nutritional Company, and they've been absolutely fantastic to work with us. And they are all local here to Las Vegas. And also we distribute via our website, and we distribute here out of Las Vegas and from those sales on our website, as well as on Amazon. And we actually use the local Amazon distribution here in Vegas. So we have a very large distribution center in Vegas for Amazon, so we partner with them. And so you can find us on Amazon. And if you're an Amazon Prime member, you get your shipping for free. So do check us out.
Yeah.
So so thank you, Dr. Stockwell.
Yes.
This was awesome.
Great. Thank you so much.
So today we got to learn a lot more about our chief innovation individual, our president and co-founder, Dr. Erica Stockwell. And she is quite the incredible lady. She's not just your normal OB-GYN. As you have just heard, she has done it all and seen it all, and has a lot of personal experience as well as patient experience and thought going into our prenatal vitamin, which is why it's so special. So that's kind of a good segue into our next episode. Give you a little spoiler alert. Our next episode of Be Well with Dr. Stockwell will feature Dr. Erica Stockwell again, and she will be speaking specifically to a lot of our ingredients and the whys behind why she thinks those ingredients are important. And she'll also talk a little bit about why each of those ingredients is unique and some unique properties with those ingredients that no other prenatal vitamins on the market have.
Yeah, and I would like to say too, so keep posted. Our company, our brand, our premise is all about empowering women to make healthy choices that positively affect their lives through nutraceuticals throughout the lifespan. So right now we have the one product, which is a prenatal vitamin, which was the brainchild of the company. But we do have plans to expand into supplements for women across the life stages, from fertility to pregnancy to postpartum to general health and beauty and wellness to menopause. So please definitely keep posted as we have new exciting developments to come up.
Definitely. All right. Thanks for tuning in, everyone, and we'll speak to you in our next episode.
Thank you.